Hi, I'm here to answer the questions you've sent me about anti-wrinkle treatment. So the post I posted is about a lady in her 40s and she had some lines across her forehead when she raised her eyebrows, and she had some frown lines which were successfully treated. So what products do we use, and is it the same as dermal fillers? The products we use for relaxing muscles is botulinum toxin, which is derived from a protein from a bacteria called Clostridium botulinum. When this protein is injected into the muscle, it blocks the nerves, the connection between the nerves and the muscles, and temporarily relaxes the muscles and gets rid of the lines. Over a period of 3 to 6 months, there is recovery and new connections made, and then the muscle activity returns and you see the lines come back again. There are a few on the market, but the common ones we use are Botox, Azelaic and Bocuchem. These are not the same as fillers. Dermal fillers are a range of man-made or synthetic products with varying density or thickness, and these are injected to fill up and create volume. So they're often used in the cheeks, in the lips to add volume, and they're also used in the lower face to fill up lines around the mouth, for example. So the next question I've got is, I have wrinkles when I'm not frowning. Will this treatment help my situation? Well, because as I explained, the treatment only works on muscle movement. If you have lines while you're resting, so when you're not doing any expressions, these lines are not going to be treated with Botox or botulinum toxin. However, in some people it may appear more softer than they were. Next question is, what to expect in this type of consultation? So it has to be a face-to-face consultation with a doctor who's going to prescribe the medication. So during the consultation, they'll go through your medical history, medications you're on, any allergies you might have, and any previous treatments you've had. They'll go through the procedure, the treatment risks and benefits, and also they should give you time to think over the treatment, to consider if you wanted to go ahead with the treatment. This is a standard General Medical Council protocol that we use for all treatments. Next question I have is, how painful is the treatment? Well, the needles we use are very small, so the discomfort that people experience when they have the treatment is quite minimal. It's not painful. So the next question is, what are the immediate effects of the injection? So straight after the injection, you will have some bumps at the injection sites, because these normally settle down in half an hour or so. Some people will develop headaches, flushing, facial pain, itching or rash around the area, bit of fatigue, flu-like illness. These are quite common after the treatment. There's always a risk related to putting a needle through the skin, and these are infection and bleeding, but these are minimized by carrying out the treatment in a clean environment, using products to clean the skin before the treatment's offered. It's very rare to have an anaphylactic reaction to botulinum toxin, but I always have an EpiPen on standby if need be. Next question I have is there any restrictions to my activities after the treatment? So depending on how easily you bruise, you might get some bruising, but this normally settles over the few days. You have to avoid alcohol and excessive exercise over the next 24 hours. And this is because these increase the blood flow to the face, and by doing that they can take away the drug and reduce the effectiveness of the treatment. Also, we advise you to avoid using makeup and also having facials because that can increase the risk of infection. How soon after the treatment will I see some effects? The effects are never visible straight away after the treatment. It takes about 4 to 5 days to start seeing some effects, but is only fully effective at about 2 weeks after the injection. So most practitioners ask you to have a face-to-face review at 2 weeks after the treatment. Next question is, what are the possible complications of this treatment? So you have to remember this is a medical treatment, so we've always got to think about that. So the complications are usually due to the placement of the product in the wrong muscle group, or diffusion of the drug into the wrong area. So this can result in a brow drop, so your eyebrow goes lower, or a lid drop where the lid actually goes lower than it would be. Some of these can be reversed, and the effects will wear off in 3 months, so that's the positive aspect. Sometimes the eyebrow, the outer edge, can be higher than desired, and sometimes that could be corrected, but in some people they prefer to have that look. Next question is, can men and women have the treatment? The answer is yes. The injections are exactly the same, but men usually need a higher dose per injection point because they have stronger frown muscles. Next question is, are there any circumstances when you can't have the treatment? So the drug is licensed for the ages of 18 to 65. I would not treat anyone under the age of 18. Over the age of 65, some people might find it effective, although it's not licensed as a treatment for wrinkle reduction. You can't have it if you're pregnant or breastfeeding, and there are some neuromuscular disorders that are contraindications. So that's why a good history is very important when you assess a patient for this treatment. Okay, so the next question is, if I stop having treatment, would I look worse than I started off with? The answer is no. Let me see if I can explain this. Once you stop having treatment, the lines go back to the way they were before you started the treatment. But because over the preceding months the lines were less visible, it might appear that the lines are more after you've stopped the treatment, but that's not the case. Next question is, I have dark skin, will I have the same effects? Yes. The treatments are not affected by the type of skin you have, so you'll get the same benefits. Next question is, how safe is the treatment? Botulinum toxin has been safely used to treat medical conditions like bladder problems, migraines, excessive sweating underarms. For cosmetic treatments, a very low dose is used, so they're generally safe, but the results do vary between individuals, and you do have to have repeated treatments to maintain the effects. So I hope I've covered all your questions. Thank you for listening.